the present video lecture, we are going to understand the mode of disease transmission with respect to different types. Let's start with introduction. Breaking the chain at the mode of transmission is one of the most important ways to interrupt the spread of infection. This is where infection prevention and control strategies can be most successful. Here, if you want to break the chain of any disease, that time we have to first understand the mode of transmission. By understanding the mode of transmission, we can prevent and we can control that specific disease. Microorganisms are transmitted in healthcare settings by mainly four ways. Now, first way is the contact, droplet, airborne, and common vehicle. Now, these are the four ways by which any disease or any microorganism can transmit in the healthcare settings. Routine practices are designed to reduce the risk of transmission. Microorganisms vary by size, the length of the time that they survive on the surface or in the air, and the method of getting around. These factors, plus the variability in virulence, the complications of treatment, and the complex symptoms, may require special treatment of some patients. These additional precautions are grouped based on the mode of transmission of the infectious agent. Now here, if you wanna break the chain of any disease, that time first we have to understand the mode of transmission of the disease. Then we can prevent and we can control that disease. Mostly the disease or the microorganism can transmit in the healthcare settings by four ways. First one, contact, droplet, airborne, and common vehicle. These microorganisms are vary in size and they are vary the length of time that they survive on the surfaces or in the air, and the method of getting around. And this transmission of disease or infection is totally depends on the virulence factor present inside the microorganisms. On the basis of that virulence factor, they are going to produce a disease in the host. Next point, that is the table of survival times of microorganisms on hard inanimate surfaces. Now here we are going to see the organism survival with respect to the time. The first one is adenoviruses. Now adenoviruses can survive up to 3 months on the inanimate surfaces. Clostridium difficile can survive up to 5 months on inanimate surfaces. Coronavirus will survive for only 3 hours. E. coli up to 16 months. Microtuberculosis up to 4 months. Norovirus up to 7 days. RSV virus up to 6 hours, and influenza virus 1 to 2 days. Now first one, contact. Now contact is the most frequent mode of transmission of healthcare associated with the infections, and it can be divided into direct and indirect. Now here the contact is the most frequent mode of transmission of healthcare of infections, and it is mainly divided into two ways, that is contact, direct contact, and indirect contact. Now it is an example of infectious diseases, and the example of contact transmitted microorganisms is the coronaviruses, which are responsible for many gastrointestinal infection. First one, direct. Now it involves direct body surface to the body surface contact and physical transfer of microorganisms between an infected or colonized person to another person by touch. Now here the direct contact means what? Here it involves a direct body surface to body surface contact. Now here what we have to understand here, if you are coming in contact with another body, then the transmission of disease occurs. And another, that physical transfer of microorganisms between infected person and in a healthy person. If we have contact with any infected person, then that disease from that infected person will come in our body, which is healthy body. Another one is indirect. It involves the contact between a person and contaminated object. This is often a result of unclean hands contaminating an object. The microorganisms remain on this surface to be picked up by the next person who touches it. Now second one, indirect contact. Now this indirect contact occurs in between a person and a contaminated object. Now we know that in daily life we are dealing with a different contaminated objects, such as in kitchen, in hall, in bedroom, in schools, and different objects. So on that objects, there are many microorganisms are growing. So when we are coming in contact with such contaminated objects, then that microorganisms come on our body, and they will do entry in our body. So that's what the disease occurs. Next is the droplet. Transmission occurs when droplets containing microorganisms generated during coughing, sneezing, and talking are propelled through air. Now, see, these droplets are mostly coming through coughing, sneezing, and talking. These microorganisms land on another person, entering the new person's system through contact with his or her conjunctive, nasal mucosa, or mouth. These microorganisms are relatively large and travel only short distances, up to 6 feet or 2 meters. Now, these see droplets are coming through coughing, sneezing, and talking. And this, when you are talking, no, in very loud way, or you are coughing or sneezing, doing sneezing, no, that time the droplets are coming from your mouth, and that droplets are going on the another person mouth or surface, and through the contact with his or conjunctive or nasal mucosa or mouth, they'll enter in another healthy body person or infected body person. That's what the healthy body will become infected when they comes in contact with the droplets of another person. However, these infected droplets may linger on surfaces for long period of times, so the surfaces will need additional cleaning. For this reason, there may be both droplet and contact precautions required at the same time. Examples of microorganisms that are spread by droplet transmissions are influenza, colds, respiratory enterovirus, RSV virus, and some organisms causing pneumonia. So this is all about the droplets. Next one, airborne. The airborne word itself indicates that the microorganisms or their diseases are spreading through the airs, known as airborne infections. Airborne transmission of infectious agents occur either by airborne droplet nuclei, dust particles containing infectious agents. These are the two ways by which the airborne transmission of infectious agent occurs. First one, airborne droplet nuclei means the small particles of 5 mm or smaller in size. Next one, dust particles containing infectious agents. Microorganisms carried in this manner remain suspended in the air for long periods of time and can be dispersed widely by air currents. Because of this, there is a risk that all the air in a room may be contaminated. Some examples of microorganisms that are transmitted by the airborne routes are microtuberculosis, rubella, varicella, and hantaviruses. Now, see, the airborne infections or airborne transmission is nothing but the infectious agent or the pathogens will transfer from one person to another person via air, and here they will transfer via airborne droplets. Means the droplets, those are smaller than the 5 mm, and next one, the dust particles which contains the infectious agent. These are the two ways via transmission will occur, and the examples are tuberculosis, rubella, and varicella hantaviruses. Now here we can see this figure. Now the person is talking or sneezing, through which the atomization is occurring. I mean, the particles are coming and the droplets are coming, and these droplets are going on the surface, and this is known contact transmission. Okay, here another person like coughing, the airborne transmission is doing this is stuff, it totally depends on each other. Next one, common vehicle applies to microorganisms that are transmitted by contaminated atoms such as food, water, medications, medical devices, and equipment. To inhibit the transmission of microorganisms by this mode, clean patient equipment between uses with different patients, handle, store, and prepare food properly, careful store and draw up doses of medication from multi-dose medication vials. Okay, so here the common vehicle, this is very important one for the transmission of diseases, because see, common vehicles means what, the contaminant items such as food, water, medication, medical devices, and the equipments. That's what the majority diseases in the hospital occurs through this ways, because we knew that in the hospital like different types of microorganisms are there, because different patients are coming from outside. So that's what this transmission occurs through that one. To inhibit such a transmission, what we have to do, so we have to first do that, clean patient equipment between uses with different patients, and handle, store, prepared food properly, careful store and draw up doses of medication from multi-dose medication vials. Then and then we can prevent or we can inhibit the transmission of microorganisms. Thank you.